We good?
Yep.
Okay. So, I am doing this presentation for school, and I chose heart disease because we all work in cardiology. Woohoo! And heart disease is the #1 killer of people in the United States. So, this is a requirement for the class and for my bachelor's program, and the reason that I'm doing it for you guys in part is because the better educated you are, the better educated the public is, the better we can help these heart disease patients be more compliant and hopefully decrease their risk.
Yeah.
So, the first, I already said that. According to the American Heart Association, heart disease is the #1 cause of death in the United States. Healthy People 2020 also identifies heart disease as a topic of concern. Puppies in the presentation. They report a goal, the goal of heart disease is to improve cardiovascular health and quality of life through prevention, detection, and treatment of risk factors for heart attack and stroke. As individuals who work with cardiac patients, I hope to better educate you so you're better able to help your patients. My goal is to provide you with the resources you can share with your patients so they know their signs and symptoms, better education, health disease management information when patients would seek professional advice. Studies have also proven that patients who are better educated regarding their disease and management of the disease have better health outcomes than those who are not. Oh, it changed on me already.
You put a timer on it?
Probably, but you know, let's just wing it. I thought if I hit the thing, it would go. So, heart disease is any disease of the heart. It's also referred to as cardiovascular disease. It's a narrowing or blockage of the blood vessels may involve one or multiple vessels. Blockages that become complete or break off and obstruct the vessel may lead to a heart attack. And heart disease is the #1 killer in both men and women. Heart disease can be related to plaque buildup in the arteries, problems with the valves, or weakened heart muscle. And it's going faster than me. So let's just do it this way. So, risk factors of heart disease are smoking, high blood pressure or hypertension, high cholesterol, obesity, inactivity, family history of heart disease, poor diet, blockage in the arteries of your legs, kidney disease, and diabetes. Risk factors can fall into one of two categories, modifiable or non-modifiable. Modifiable risk factors are things you can change. Non-modifiable are things you cannot change. So examples of non-modifiable are age, race, family history, sex. Modifiable risk factors are important because these are the things that you can change. You can control how they affect your disease. So it would be smoking, use of tobacco products, diet, activity, obesity, stress, high blood pressure, sleep apnea, cholesterol, disease management. So, causes of heart disease. Coronary artery disease, which is the narrowing of the arteries due to plaque buildup. Heart attack is when when a coronary artery becomes blocked, reducing blood flow to an area of the heart muscle. Can also cause damage or enlargement of the muscle. Cardiomyopathy is enlarged heart. Hypertension is elevated blood pressure. Diabetes, tobacco use, and drug use. The heart is a muscle. When it's overworked, it gets large and stiff. We don't want that to happen. So what we want to do is decrease the workload of the heart. Hypertension or high blood pressure can also increase the workload of the heart, so we need to keep the high blood pressure controlled. Drug use can cause damage to the valves of an individual heart, and that's irreversible damage. Oh. Signs and symptoms: chest pain, shortness of breath, chest heaviness, dizziness, excessive fatigue, nausea, sweating, fast heart rate, pain that travels down one or both arms, jaw pain, anxiety, or back pain. Signs and symptoms related to heart disease and heart attack can look different for every individual. In an article that I read, listening to stories from women with heart disease, my experience as a nurse practitioner, symptoms may differ from one event to the next. It's also important to note that women often present much differently than men. Women are more likely to experience shortness of breath, back, neck, jaw, or arm pain, nausea, vomiting, indigestion, lack of appetite, weakness, fatigue, dizziness, passing out, or heart palpitations. What is an ejection fraction and why is it important? Ejection fraction is a measurement that we use to look at the amount of blood that leaves the heart with each contraction. Normal ejection fraction is between 55 and 70%. Ejection fraction is the measurement, it's measured with an echocardiogram or a nuclear stress test. And an echocardiogram is an ultrasound of the heart. A nuclear stress test is done using a special camera. Low ejection fraction indicates a heart is weak and not pumping blood as well as it should. This is hard to do backwards. Or upside down, whatever. Heart disease that is not controlled can lead to heart failure. So heart failure doesn't pump as well as it should. You'll have a low ejection fraction with this, and some parts of the body may not get enough blood and oxygen. Fluid may begin to build up in your lower extremities, your dependent extremities. This is chronic, and congestive heart failure can develop when heart disease is not managed and the heart begins to fail. To leave this alone. Heart disease and heart failure management, you do it with diet and exercise. Avoid tobacco, diabetes management, cholesterol management, high blood pressure management. Diet. You want to have a diet that's contains fresh fruits, vegetables, whole grains, legumes, skinless poultry, fish, low fat dairy. Reduce or eliminate alcohol, so no alcohol. Healthy diet and lifestyle choices are important in managing and preventing heart disease. Eat a well-balanced diet and request a referral to a dietitian to discuss heart healthy diet if you need more information on that. You also read dietary labels. Limit or eliminate red meat, saturated fats, trans fats, added sugar, and sodium. Some examples of saturated fats are butter, red meat, lamb, pork, lard, cream, cheese, whole dairy products. Trans fats are baked goods, cookies, cakes, pies, microwave popcorn, biscuits, creamer or margarine. Added sugar comes from candy and soft drinks. And avoid things high in sodium like cured meats, ham, smoked meat, bacon, cold cuts, ham, salted nuts, canned entrees. I already said ham. See, here I went again. Exercise benefits. Improve blood pressure, increase your HDL, decrease body fat, decrease depression and anxiety, increase your insulin sensitivity, increase stamina and energy, strengthen bone density, helps fight obesity. The American Heart Association recommends 150 minutes of moderate physical activity a week or 75 minutes of vigorous physical activity each week. Smoking cessation, quit smoking. Most preventable cause of premature death. Resources for help is a quit line, American Lung Association. The Illinois Tobacco Quit Line is 1-866 quit yes. American Lung Association has the Freedom from Smoking program. The CDC has the Quit Line mobile app, and you can get that on the CD website. And then there's freedomfromsmoking.org. And then this little picture is a timeline of what happens when you quit. So like 20 minutes after quitting, your heart rate and blood pressure drop back to normal. 1 year after quitting, The risk of getting coronary heart disease is cut it in half. I can't read that on here. I need to not touch this thing. Health management with your cholesterol, diabetes and blood pressure, cholesterol. Your liver actually produces about 75% of your cholesterol. The remaining 25% is from dietary. If you doctors recommend you make diet changes and your cholesterol numbers are still high, you'll probably be started on a statin. So medication compliance is important. Diabetes puts you at an increase for heart disease, and blood pressure increases your risk for a heart attack and stroke due to increased pressures on the walls of the blood vessels. So make sure you take your medications. Living with heart disease, again, stress disease management is important. Stress management, weight control, healthy eating choices, medication compliance. Stop smoking if you smoke. Don't start if you don't smoke. Keep your blood pressure under control. Maintain a healthy weight. Increase activity, diabetes control. When to consult a medical professional. If you have new chest discomfort, pain, or heaviness, pain that radiates, dizziness or lightheaded, passing out, jaw pain, new fatigue or constant fatigue, irregular fast heartbeats, swelling or edema, shortness of breath, unexplained weight gain, or if you're unable to lay flat in bed at night. So some good questions: when to call your MD, your doctor, if you're having any of those symptoms. Did you learn any new resources? Quit line, anything? Take your blood pressure.
I didn't know about the quit line.
1866. Yeah, quit yes.
I mean, I'm not quitting anything because I'm not smoking, but
Yeah, neither am I.
I didn't know that there was a line for it.
You should tell my parents that.
You can tell your parents that. Why is blood pressure control important?
Don't look at me.
I was looking at both of you.
It's important because high blood pressure causes heart disease.
Yeah, it increases the pressure on the walls of the arteries, which can cause problems. Can jaw pain or fatigue be an indication of a heart attack?
Can be an indication of heart disease or heart attack. Yes.
It can. Women, a lot of times, will have jaw pain. That's the only thing they show up with is they're complaining of like a jaw ache, left-sided, having a heart attack. Not always. Not always, but that is one of the things that they'll show up with sometimes, and then they'll say they didn't know that, no idea. So conclusion: heart disease is the #1 killer of death and cause of death in the United States. Disease management is important to prevent progression of the disease. Medication compliance is important, and it's important to keep follow-up appointments and testing with your physician and stay on track, because once you have it, you always have it. It doesn't go away. And then here's just a list of references of things that I used and whatnot. Do you want me to open them up so you can look at them? Thank you, ladies.
I'm just gonna look at